Hello, Mama!
Hi, Papas!
Yes, welcome to Facial Value again. And on this video, we will be tackling something of a topic that is being discussed globally, and that is
Coronavirus
yes,
19.
yes,
COVID-19.
yes, COVID-19. And on this video, we will be discussing certain myths and the actual facts about it, and then how we can, in our own way, be able to assist the government and other people around us to contain this virus from spreading and even getting worse. So please don't go away. Okay. Nako, mga mamas and papas, medyo serious tayo ngayon. And we are discussing COVID-19 because the most affected people by COVID-19 are aging population, which is from ages 60 and above with compromised health.
Yeah.
Yes.
So, when you say compromised health, ano ibig sabihin?
Compromised health are those people with underlying conditions such as diabetes or heart conditions and stuff like that.
Okay.
Because yung immunity system mo is low, so the effect on you is even harder than the normal healthy people. Kasi honestly, we are discussing this and why I am the one speaking as a resource person, because we will touch on the infection control, which is very critical in preventing COVID-19 to even spread further and be able to contain it, in our own simple ways.
Okay.
Ayan. So, simulan muna natin yung mga myth.
Myth, okay.
Myth number 1.
So, myth number 1, they say that it is the deadliest among na na-experience natin compared to SARS or MERS.
And that is not true.
Oh, not
Because,
true?
yes.
Bakit?
Well, we are just scared in terms of COVID-19 because honestly, mga mamas and papaps, this is the mutation of the virus from the coronavirus that is similar to SARS and MERS. But unfortunately, the people who study this type of viruses are not well informed in the actual aspect of the virus. That's why the expert are just learning about it as we go along.
Learning by doing.
Yes, and then that's the problem why there are a lot of misinformation out there, and then it becomes a reality once it is shared in social media. So, mga mamaps and papaps, that's one advice I will give you all. Let's not make it worse. If you have an information and you are not sure that it is a fact, then let's stop promoting it as a fact.
So, stop the fake news.
Yes, please. Kasi this information may be detrimental to others and make things worse.
Wow.
Because we are scaring people or making them do something that is not right. So the tendency is that instead of you helping it out, you make it worse. So that's one social behavior that we can change.
Okay. Next thing is that using face mask. Hindi yung face mask na.
Yeah, hindi yung sa skincare. Okay. So mga mamaps and papaps, since I lecture about infection control, this is one advice I will give to everyone. Now, honestly speaking, the face mask should be available to the medical health providers and to the other health providers like dentists, like me, to have the availability of the use of face mask, and for those people who are already affected by this virus. Because if you keep hoarding the face mask, and unfortunately, majority of the face mask came from China because manufacturing sila ng majority of medical devices and medical materials because they manufacture it cheap. So the problem of hoarding them, and if you are wearing them and it's not necessary, the tendency is you're taking away the protective gear that is very important for health providers and those who are truly sick.
So, mas importante na yung mga health providers ang may mask.
Correct.
And then yung mga
affected already.
na. Pero yung like normal ako, halimbawa pag lalabas ako, I don't necessarily have to.
You don't. Because on COVID-19, okay, supposedly, according to WHO, it is not airborne.
Okay.
So, wearing a face mask is not a necessity. So, the transmission of COVID-19 is more on droplets transmission. So, please, yan lang ang pakiusap ko. Let's protect our health providers kasi pag silang nagkasakit, who will take care of those who are sick? Because they don't have the face mask. So, another thing is that a face mask, once it gets wet, it doesn't protect you. So,
May narinig ako, sinabi mo na may autoclave or nag-steam
yes, nag-steam ng face mask, nire-reuse nila. Kasi nga, yung mga health providers like dentists, us, who are very vulnerable in getting this COVID-19, don't have the availability of face mask anymore. Because ang dami nga nag-hoard. And then, it becomes very expensive.
Same with alcohol, right?
Yes, same in alcohol. However, on the face mask, for those who really need the face mask, there is a proper way of using the face mask. You don't use the face mask like this because that is not protecting you. You do it like this, and then go over here and over here. So, that's how you do the face mask. Now, the purpose of the face mask is not only to cover your face. The reason of a face mask is that...
sobrang ganda mo daw.
Yeah, yun na nga. So, well, but what it really does, unless artista ka, then you do the face mask to cover your face. Yes, but in terms of the diseases like this, what the face mask, the main purpose of the face mask is to filter the virus and the bacteria that comes into the face mask and not go to your face. See? So, meron yan silang filter.
Pag may droplets na pumunta sa mata mo, paano yun?
Then, you have a problem. And that's why people also wear a face shield. So, the face shield protects the health provider and those who are exposed to COVID-19 patients or other patients that have viral diseases that are communicable or nakakahawa. Then, you need the face shield if that is the droplets.
Maganda pala kung halimbawa nagmumotor ako tapos may helmet ako, huwag natanggalin yung helmet ko, no?
Correct.
Nakatigil ka ba sa face mask?
Correct. Ayan. So please, isa yan, parang habag, let's not hoard on the face mask because nilalagay nyo sa alanganin ang mga health providers na nag-aalaga sa mga may sakit. So, you only wear a face mask if you yourself is affected by this virus or for health providers.
So, next one. Pagdating sa social behavior na nabanggit mo kanina,
yes.
So, anong mga dapat baguhin sa mga social behaviors?
Because we don't know so much about this virus or what it actually, by a certain number of period wherein the experts and the scientists or the virologists was able to study this. So, yung information nila is coming from the ground or where the ground zero, kung saan nangyayari yung disease. So, as of the moment, according to them, this is not airborne but more on droplet transmission. So, unfortunately, even before COVID-19, if you notice, halimbawa mga mamaps and papaps, pumunta ka sa toilet halimbawa, you watch a movie and you took a pee or nag-number 2 ka dyan, mapapansin mo when most of the malls or most of the public facilities, kulang na lang gawing tubig yung hand wash or the soap. Okay? And this one, again, you took, it's part of most communicable diseases comes from our body as well, and majority from our feces. Okay? So, ang ending, if you don't wash your hands, and then yung nagbasa ka lang ng tubig, yan, ang ending yan, you transmit it from the flash, kung saan ka nagpa-flash, to the sink, to the doorknob, to everything that you touch, including when you do the handshake.
Sabi nga nila, pag pasok ka ng CR, use your elbow na lang daw, or...
And then, yes, or kaya itong knuckles mo when you do sa elevator.
Ito talaga yung paghahawak mo sa face mo.
Yes. And that is why, mga mamaps and papaps, this is what I can advise you to do, okay? When you wash your hands, it's really like you grab it like that. And then, as much as possible, remove your jewelry. Okay? And also, if you have, like for example, manicure or cutics, the bacteria or the virus, it sticks with it. That's why majority of dentists, they don't have manicure or, cutics. Kasi nga, yung bacteria and virus, it sticks with that. Okay? And then, when you wash, you really have to sing happy birthday. Happy birthday to you. And then, ang
Baka
pakiusap,
iniisip nila, bakit kakakanta ng happy birthday?
hindi, sayamahin mo lang, the length,
the
yes.
length,
Because anything, disinfectant, soap, whatever it is that you want to kill a bacteria or a virus, it only works depending on the concentration of the ingredient of the disinfectant and or the sterilizing liquid and the time it is exposed. That is why mga mamaps and papaps, if you use alcohol, okay, alcohol only works if the material is exposed for disinfection at least 20 minutes. So, unfortunately,
20 minutes. So, dapat
yes,
nasa 20 minutes yung
correct.
So, wala.
Unfortunately, alcohol evaporates fast.
Very quickly.
And that is why yung mga hand sanitizer is much better because it has alcohol content which has to be at least 70%.
So, nagsistay.
And then, its consistency is in gel.
Thicker.
So, the exposure of your hands on the hand sanitizer that has alcohol is longer.
So, it doesn't instantaneously kill.
Yes. So, yan yung mga kailangan gawin. Ang pakiusap ko sa mga owners of businesses, sa malls, sa clinics, and everything else that has a public toilet, please naman, provide a very good soap. An antibacterial soap. Huwag niyong haluan ng tubig to the point na wala nang effect yung soap. And then, for the one who's using it, please wash your hands at least 20 seconds. And then, yung mga fingernails nyo, at least do it like, clean it. Mas maganda nga kung may brush kayong kasama. But, if you don't have, just make sure that you wash your hands longer enough. And then, once you wash it, do not touch anymore the faucet, the whatever. Get a tissue, and that's the one you will hold in order to open the door of your toilet or the faucet and stuff like that. At saka mga mamaps, isa pa na tip ko kahit walang COVID-19. Yung ganyan, yung pinagdadry nyo ng hands, it's actually
blower.
Even dangerous. Yes.
Kasi
Because the mist that comes from the people who are doing that is also going through the same. So, in drying your hands, it is better to use a towel or a napkin. So, please lang, sa mga malls, please, sa mga businesses na may public toilet, please provide. Kung sa tingin nyo is very expensive, then charge. Charge the user. Sa Europe, ganun eh. You have to pay 1 euro, 2 euro, and then you have all the stuff that will allow you to, clean properly your hands. Okay. So another thing. Last.
Sabi nila hindi daw natatransmit sa hayop or sa pets, for example, sa dogs.
Yes, for COVID-19, yes. Kasi although there was a test recently sa WHO na nakita nila may COVID-19 sa nostrils ng dog, but it doesn't transfer to human. Okay, and also the dog doesn't get sick.
So officially sinabi ng WHO,
it's not transmittable from our pet to the owner.
Kaya pala sabi nila doon, yung poo daw, let the dogs out.
Okay. Yes, okay. Tapos, again, para hindi siya matransmit ng very fast, kasi mga mamaps and pop-ups, huwag kayo masyadong nagpapanik when the numbers of those affected jumps like times 10 or times 100. It is not because ganun ka-fast yung transmission niya, kasi tandaan nyo, may incubation period siya. Okay? Which is 2 to 14 days. However, nagiging parang ngayon 3, tapos naging 300 o 30 the following day. It's really because the time frame of when the people are tested. Kasi nung dati wala pang masyadong availability ng test kits. Yes. So, parang meron tayong false sense of security na this is only the number of people affected by COVID-19. Because
So
precisely,
expect na tataas pa.
yes, tataas pa because, again, ano siya droplets transmission. And yung droplets, kumbaga, parang tuberculosis din. Yung TB virus, actually, naglalast siya sa surface between 8 to 12 hours. And COVID-19, according to WHO, again, it can last a few hours up to 3 days depending on the type of the surface.
Okay.
So, for example, in the glass, lalo na sa mga mom-ups and pop-ups sa cellphone, then, syempre, nagdadadal ka niya, tatalsik yung laway mo dun sa cellphone. The glass, according to them, the COVID-19 can last like 2 to 3 days na active and can be transmitted to someone else.
Seryoso.
Yes, yes. So, again, as I've said, one of the, kasi nga, because we don't know so much about this virus, not that it doesn't exist, but we don't know too much about it na factual, there's a lot of misinformation. Now, because there's a lot of misinformation, and we don't have vaccine or prevention for it, the only way to contain it is by changing our behavior as an individual.
Okay.
So, mga mamas and papaps, in order to summarize what we can do in order to help our government and our neighbors for this virus not to spread even worse in a situation right now, is one is wash your hands properly. Not just wash, but
Seconds.
properly wash it. Or if you do not have, then use a hand sanitizer gel. Second is please do not hoard materials. Like the face mask, you don't need to use it if it's not necessary or if you're not a health professional or somebody who is affected. Kasi you just affect the price of these products and it will not help everyone. Third is yung sinasabi nilang social distancing. Yes. So, yeah. Kasi nga, natatransmit siya 6 feet. Within the 6 feet radius, di ba? Like, for example, ako yung nagsasalita, tumatas yung laway ko. If I have COVID-19,
Nahawa na ako.
yes, oo. So, and that is why, like, for example, in Europe, it is, ang bilis ng transmission nila kasi the way they greet people is like, they kiss 3 times. So, yun nga, yung elbow jab is good or yung namaste, yung gano'n, yung magbawo ka nila to just greet the person. Like recently in a group or in a mass meeting that I attended, I frankly tell the people that let's not just shake hands. It is nothing personal, but it is something to protect you and to protect me. Ngayon, yes. And then, fourth is that when you do travel, it is very important that you wipe the surfaces. Now, unfortunately, not everyone has the availability of wipes that is medically grade. So, katulad ako, since I practice dentistry and tendency, I have wipes that is medically grade and actually can disinfect any surfaces. But as usual, you don't need to be crazy. Just make sure that you have something to protect and do not touch your face if you are in a public location, like for example handling cash or stuff or surfaces that may be exposed to this virus.
Okay.
So wash your hands and then do the disinfectant. So yun mga mamaps and papaps.
Yun. Okay.
We hope that we are able to shed a little bit of light on how we can be as an individual have a productive and with sense in preventing this COVID-19 to even spread further. Diba?
Okay,
Or
I
to
agree.
contain, yes. So mga mamaps and papaps, while we are in social distancing in the entire Metro Manila, okay, just binge on a facial value channel. And if you like this, do thumbs up and do subscribe in our channel. Yes. At saka pag nag-subscribe kayo, Ang aga mo notification. Hit the notification bell. If you have any question, kasi nga we're trying to make our videos a bit shorter. If you have any question in regards to how to make sure you practice infection control in your own way without hoarding all these products, okay, please do comment below and I will for sure answer it. Ayan. So mga mamaps and papaps, sana may natutunan kayo and yung mga matured people like myself, please do take care. Okay? Try to, stay at home na lang. Especially if you're a compromised person. Okay? So mga mamaps and papaps, stay safe. Bye!